Hi, my name is Lizethmunoz, and I'm going to be going over the Module 6 SBAR assignment for the Foundations of Nursing Practice. So first I'm going to be going over the scenario, which I chose scenario number 5, respiratory. And it goes as follows. Mr. Jones is a 35-year-old and had a bowel resection 3 days ago. He is on GSU in room 221. Yesterday morning, it was noted that Mr. Jones required 50% oxygen to maintain SaO2 levels of 92%. His lung sounds were decreased in the bases. His cough was weak and ineffective. He required much coaching to use his incentive spirometer and was only able to generate inspiratory volumes of 400 ml. Mr. Jones was started on IPPB therapy for lung volume recruitment. Today, Mr. Jones states his pain is greatly reduced. He is able to use his incentive spirometer and generate inspiratory volumes of greater than 1500 ml. His SaO2 level is at 94% on room air. He is able to produce a strong cough on command, and his lung sounds are clear in all lung fields. So first, the important information that we are wanting to take out of this is that we can clearly note that the patient has made a great improvement. Compared to what was dictated on his chart yesterday, he is no longer on oxygen and is now able to maintain an SaO2 level of 94% at room air. His inspiratory volume has also increased about 1100 mLs. His lung sounds are now clear in all fields, and he is able to control and produce a strong cough. So next, we are going to be going over into a mini simulation of me interacting with Mr. Jones and finding out this new assessment of his improvement, and then I will be calling the doctor to give him an update on his patient.
Come in.
Hi, how
Hello.
are you doing today?
Doing all right. How you doing?
I'm doing well. My name is Lizeth. I'm going to be your nurse for today. Can I please go ahead and have you confirm your name for me?
My name is Mr. Jones.
Okay, perfect. And your date of birth, please.
1186.
Cool. Let me just check your bracelet. Okay, thank you. And how are you feeling today, Mr. Jones?
Doing okay. My pain has gone away.
Perfect. That's really good to hear. So I'm looking here at your chart, and I see that yesterday, whenever you were asked to blow into the spirometer, you had a inspiratory volume of 400 mLs. So right now, I actually want to go ahead and have you blow into the spirometer again, just to see if there's been any type of improvement.
Okay.
And here you go. You could please go ahead and work that blow into it for me. Okay, very good. So I see actually here a very great improvement. You went up to 1500 mLs, so that's about 1100 mLs better than you were doing yesterday.
Yes.
Next, would you mind if I listen to your lung sounds?
Go ahead.
Okay, perfect. Let me just go ahead and get my stuff on. Okay, so first I'm going to listen here. I'm going to have you breathing deeply. Exhale. Very good. Now I'm going to have you do it once more. Breathe in and exhale. Perfect. That actually sounds very great. Compared to yesterday, they were a bit more decreased. Right now, you actually have very clear sounds. So that's very good. I actually do need to call your doctor with an update. So before I go and do that, is there anything else I can help you with or can bring you before I go?
Oh, just have a good day.
Okay, thank you very much, Mr. Jones. We'll see you in a bit.
Have a good one.
You too. Okay, so now I am back at the nursing station and I am getting prepared to contact the doctor for Mr. Jones. So I could just give him an update on how his patient has improved. And one very important factor to remember here is always know the doctor's preferred method of contact. And in this case, I know this doctor just likes to be directly called into his cell, so that's what I'm going to be going ahead and doing. Hi, Doctor Who. This is Lizethmunoz. I am the RN in the respiratory unit, and I'm actually giving you a call in regards to your 35-year-old male patient who is in room 221. His name is Mr. Jones, and I was just calling you with an update because he's actually made pretty great improvement to how he has been doing yesterday. So, a quick background on this patient. He was admitted 3 days ago due to having a bowel resection surgery. So, it was noted yesterday or 2 days after his surgery that he was actually having to be put on oxygen at 50% in order to be able to produce a 92% SaO2 volume. So he was also having inspiratory volumes of 400 mLs, which, because of those reasons, he was started on IPPB therapy. So today, upon assessing the patient, I noted that this therapy must have been working very greatly because he had very great improvements. His inspiratory volume, after I had him blow into the spirometer, actually rose up to 1500 mLs. And upon listening to his lung sounds, they improved. Yesterday, it was noted that he was having pretty low sounds. He was not having a very good cough. It was weak. And today he actually had a pretty good lung volume. He had a good strong cough and he was able to manipulate it. So upon receiving this assessment on him, I believe that this patient um, I would recommend he is good to be taken off of the IPPB therapy. And as far as it goes on my end, he is cleared and ready to be discharged home. Okay, thank you. So next, the questions. So for question number one, what were my thoughts on the clinical scenario? So I chose this one because I thought it was pretty interesting. I actually don't have any experience with respiratory or anything like that, so I chose this one. There was a couple things that I had to research, like IPPB therapy. Um, I wasn't aware of what that was, so I had to, look at a couple of videos, see what it's about, how it's done, what it's for. So that was pretty interesting to me. Second, what do I think could have been added to the S bar? So I saw that this scenario lacked important things such as vital signs that would have been helpful to have. Lab tests would have been helpful to have as well, just to kind of help diagnose or obtain a better diagnosis for the patient, like were these breathing problems because of an infection? Even though I did read that usually this type of bowel resection surgery does have risks of difficulty breathing. So I assume that this is what the patient was going through, was just a adverse effect of having this surgery done. So that would have been helpful, having vital signs and labs, to be able to present to the doctor as well, because that's always very important information to introduce to either the doctor or the next nurse who's coming onto the shift. The third question is, what do I think we didn't need in the S bar? So, as far as the scenario goes, I think that all this information which was included into the scenario was pretty well needed. I don't really think that there's anything I would exclude. So yeah, everything was pretty well needed in order to give a good report to the physician or the oncoming nurse for the next shift. And number 4, if we did this conversation again, what should we do differently? So I just kind of wish I had better materials. I had to improvise for a spirometer, and it would have been pretty neat to be able to actually obtain one and have the participant, do it, and for me to be able to actually see the little ball go up and see the milliliters of the volume and all that. So that's probably one of the things I would have done differently, and better lighting. Um, do I think that the significance of the situation was clearly presented to the physician? Uh, so yes and no. Yes, because he did get a full assessment of the breathing and the improvement of the respiratory for the patient. Which, me being a respiratory nurse in this scenario, I believe that's obviously a very important thing to provide to the doctor. Um, And no, because like I said, I feel like it was lacking some information and pretty important information at this point, such as the vital signs. I think it would have also been nice to know why the patient underwent the bowel resection surgery, and that could have helped add more important information to the doctor and maybe even pinpoint why the patient was having difficulty breathing. And then, of course, just any type of labs I think would have also been significant to introduce to the doctor. That way, we could have all had a better diagnosis of the patient. But in other words, it was pretty clear, I feel like, and the presentation of the scenario was pretty neat. So I had fun doing this. Thank you.